Ruth, we wanted to dive into sort of the leading edge of what's going on in trauma therapy. And we had Seaburn Fisher on the show not long ago, and she was singing your praises, and she said, we must talk to Ruth. So we've got you on the show to find out exactly what is changing, emerging, what's on the leading edge of trauma therapy. So where can we dive into that topic?
Let's start with, how do we treat trauma? How can we approach this topic? And often it's a very political topic, but I think it's actually, there's a simple way to start into the topic that makes it non-political, and I think that reduces sort of the infighting, because I think one problem is that, developers of certain therapies always think, that is the approach. And I want to move us a little bit away from that, because I think when we think about an integrative approach to trauma treatment, it's really using all the modalities and bringing them all together.
And kind of going back to the person a bit is a nice place to start, isn't it? Mm. What actually is a human going through, and what helps a human, rather than
Absolutely. Yeah. So always starting with the person and asking the question, how has this trauma affected you? Right? And not just how has this trauma affected you, but also how has the aftermath of the traumatic experience affected you, and what's most traumatic for you. And also seeing the trauma in the context in which it occurred, right? Because the context can make a huge difference. So really understanding the individual, and then tailoring the treatment to the individual and to the individual's suffering.
Yes, because we can read a lot about trauma theory, and I guess we can generalize a lot of that, and we sort of make an imprint upon the person that's in front of us and say, well, the way that they're presenting it has to fit into this theoretical framework somehow. But that's probably not the best approach. We start sort of with just exploring the person themselves.
Yeah. And I think, one thing that I've been taught, and a lot of us are taught, is to treat a diagnosis, right? And, there's certainly something to that, but I think you need to treat the person and really take that personalized approach and, figure out what is the major issue for this individual. A little bit like the psychodynamic therapists who are very good at, right? Really figuring out what is the major issue for this person. And so then kind of combining that with, yes, there is a diagnosis, but there is an individual behind that, and really targeting that major problem.
We often use music metaphors, because both of us are musicians. We have quite a few musicians who come on who are great therapists. Joseph Ledoux, for one. But this idea that even a great melody, when a musician's approaching a great melody, that's just where you start. That gives you the foundational framework from which you then create all the individualistic elements. And I think this is this idea that we are actually bound, that we should be bound by the nature of the method because it's been researched and because it has the evidence base and so on and so forth. Is this a burden that we're learning how to reframe, or what's the validity of that's coming with this sticking to the method?
Yeah, and I think that's a great question. And of course, evidence-based treatments are important, but I think equally important is that we keep in mind the limitations of these treatments. And, thinking about, what question we've answered with the evidence and what questions we haven't answered. And for example, some of the sickest patients, most of the patients I treat would never make it into a study because they're too ill, because they're suicidal, they're harming themselves, and those are usually exclusion criteria, right? And so I think we really need to also think about, treatment in real life.
Thank you for tuning in to the Science of Psychotherapy. Please like this video, subscribe to our channel, and hit that bell so that we can reach more people and bring you more Science of Psychotherapy. And if you're a mental health professional, check us out at thescienceofpsychotherapy.com.